This is the second training of 2 trainings for regional accountable entities and case management agencies. I wanted to start this training with a few housekeeping items. So we will be holding questions till the end of the training. And at the end of the training, we will have a Q&A session. So we do look forward to answering your questions, but please know that we will do that at the end. If you do have any questions, though, throughout the training, feel free to chat them in, and we'll take note of it, and we'll just respond at the end. Also, there will be a few opportunities throughout the training for discussion. So we do ask that when that happens, we'd love to hear from you. And if you'd like to participate in the discussion or have a question at that time, you can raise your hand and the facilitator will unmute you. You can also participate in the discussion through the chat, but we do welcome you to raise your hand and be unmuted at that time. The raise hand feature is at the bottom of the Zoom window, and I see that several of you have already used it, so it looks like a lot of you know how to do that. But if you have any technical difficulties, please feel free to send a chat in the chat box, and we'll help you with that. Next slide, please. So I wanted to quickly take a moment to introduce the trainers today. My name is Laura Gerard, and I am a consultant with JSI Research and Training Institute. And I'm joined by Amy Downs, who is a consultant at Results Count, and Laurel Karabatsos, who is a consultant at Perigo Consulting. Both Amy and Laurel have subcontracted with JSI on this project, and I'll tell you a little bit about the project before we get started. Next slide, please. So overall, the goal of this training today is to educate and inform about the best practices and introduce tools and resources that have been developed to improve collaboration and coordination between regional accountable entities, RAEs, and case management agencies, or CMAs. So some specific objectives we have for this training is that by the end of this training, you will be able to identify 3 or more best practices for RAE and CMA collaboration. You'll be able to describe the function of the cross-agency forum. You'll also be able to identify which best practices you think would be most impactful in improving RAE and CMA collaboration. And lastly, you'll be able to describe how your organization can sustain RAE and CMA coordination and collaboration. Next slide, please. So the Department of Healthcare Policy and Financing contracted with JSI in February of 2023 to conduct a stakeholder-informed process improvement initiative. This initiative included developing recommendations to improve communication, collaboration, and cross-agency coordination between the RAEs and the CMAs. The focus of this initiative is to improve member experience for individuals enrolled in Colorado's home and community-based services waivers. To gather information, the JSI team conducted key stakeholder interviews and participated in large group discussions at stakeholder meetings. We also reviewed evidence and literature to develop the best practices that you will hear about during this training. Next slide, please. So through many key stakeholder interviews in Colorado and other states, as well as the literature review, we identified best practices and categorized them into 5 themes or domains, all of which support the central goal of this project, which is to improve member experience and satisfaction. So as you can see on this slide, the 5 domains that we identified include intra and inter-agency alignment and collaboration, RAE and CMA role clarification, collaboration, and coordination, data sharing and technology, payment and performance, and contracts and oversight. And again, all of these 5 domains ultimately have a goal of improving member satisfaction and experience. Next slide, please. In total, 22 best practices were recommended, and all fell within one of the identified domains. So on this slide, you can see the domains on the left and all of the best practices on the right. I know this slide is very busy and I'm not going to spend too much time on it because throughout this training, we will be discussing the relevant best practices as well as providing tools developed in the project to help you with implementation and sustainability of the best practices. Next slide, please. So in order to increase alignment and collaboration, the best practices in this first domain include ways for RAEs and CMAs to increase and standardize their regular communication. The first best practice in this slide is collection and dissemination of innovative practices. Several RAEs and CMAs have implemented innovative approaches to access and maintain services for members with complex medical and/or behavioral health needs. In order to increase the use of innovative practices and facilitate creative problem solving, there could be an inventory or a library of creative and innovative strategies that improve access and help maintain intensive services for members with complex needs. This library of strategies could be used when coordinating care for individuals with complex needs. A couple examples of strategies that could be included in a best practice library include opportunities to build interdisciplinary teams, including non-clinical positions such as community health workers and peer navigators to deliver whole person care, and innovative opportunities to improve specific services to HCBS members when workforce shortages occur, or if members' needs are too intensive for one agency to sustain. The next best practice in this domain is opportunities to develop cross-functional strategies. This best practice is for the department and centers around establishing cross-functional teams that include both Office of Community Living and Accountable Care Collaborative staff who meet on a regular basis. The last 2 best practices on this slide have already been implemented by the department. Given the overall complexity of long-term supports and services, consistent and ongoing training is critical. Additionally, there is sometimes confusion between RAEs and CMAs regarding their respective roles. The first training conducted last week focused on the roles of CMAs and RAEs and how they work together. Both this training and the first training will be available for new staff as a recorded training. The best practice of having a cross-agency forum is underway, and I'm going to go into more detail on that in the next couple slides. Next slide, please. So the goal of the cross-agency forum is to improve coordination, collaboration, and communication between the department, the RAEs, and the CMAs. So this regular forum has goals to share information and ask questions during the forum, receive guidance from the department at the same time, seek clarification on any guidance which is unclear, discuss program policy and procedural changes, participate in trainings during the forum, and ultimately to build relationships between the department and the RAEs and the CMAs. Next slide, please. So the format of the cross-agency forum is that they will regularly meet, and currently the forum is meeting on a monthly basis. Also, RAE and CMA co-leads co-create an agenda with the department, The agenda items had clear objectives, and they seek feedback on all agenda items discussed, and decisions are made using a collaborative decision-making model. All forum meetings conclude with a summary of the meeting and specific action items. Next slide, please. Next slide, please. A meeting charter for the cross-agency forum was drafted and approved by forum participants. The charter includes an introduction of the cross-agency forum, meeting goals and objectives, the attended audience, meeting guidelines, decision-making guidelines, roles for department staff and co-chairs, as well as a note taker. Forum participants should include both supervisory and entry-level staff who are engaged in the shared work between RAEs and CMAs. Next slide, please. So we want to do a poll with you all now, but I did see that a few people have raised their hands while I was speaking. And as I mentioned in the beginning, we are holding questions till the end, but I'm not sure if people who raised their hands had a question on the content or if there was some technical issue going on. So while I do the poll, if whoever raised your hand, if you could send a chat, and one of my team members will try to address your question in the chat. Okay, so our first poll question. Are you able to see the poll? If you could nod your head. Okay, wonderful. So the first question is, on a scale of 1 to 5, with 5 being highly impactful and 1 being least impactful, please rate how impactful you think each best practice will be in improving alignment and collaboration between RAEs and CMAs. I'll give it a few minutes. I see a lot of people jumping in there. Thank you. This is great. I don't know if you can all see, but I see people are still jumping in there and answering. So I'm definitely gonna wait till I see the numbers start to tick down because we'd like to hear from everybody. And just as a quick reminder, 5 is highly impactful, 1 is least impactful. Okay, I see it looks like everybody who's going to answer has probably answered. So I'm going to share the results. Are you all able to see the results? Okay, wonderful. So it looks like the most impactful, wait, sorry. It looks like for the first one, which is collection and dissemination of innovative practices, I see that about 38% of you who responded felt like this would be very impactful, rated a 5. The next highest rating was a 3, 32%, or 119 of you felt like it was like medium impact. And then only about 43 of you went on the lower side, feeling like maybe this wouldn't be very impactful. So I'll move on to the next one, which is opportunities to develop cross-functional strategies. And here it looks like 55% of you, or a total of 204, felt like this would be a very impactful strategy. So that's good to know. Only about 8% of you, or 30, felt like this would not be very impactful. Moving on to training and education. Again, a lot of you, 58% or 215, ranked this a 5, so felt like this would be very impactful, where only 7% felt like this would not be very impactful. And then on the last one, which is the cross-agency forum, it looks like, again, a lot of you, 51% or 189, feel like this is an impactful strategy in terms of improving coordination and collaboration. And about 10% felt like this maybe wouldn't be so impactful. So I really appreciate everybody who answered this poll. It's something that we're going to, track and share back with the department, so they know what you all think might be important best practices to either implement moving forward or keep sustaining for those that were already implemented. So I want to take a moment now and just invite you all, if anyone has any thoughts on any of those best practices, if you have any reflections, maybe you're already participating in the forum or you're already collecting best practices in the library and you just want to share out what you're doing, we would love to hear from you. Again, either you can raise your hand or you can chat in a question. And I'd also like to invite any of you, if you feel like in this particular domain, if there was something missing in terms of best practices, we'd love to invite you to share anything that you feel like may have been missing and all that. Anyone want to raise hand?
Laura, this is Laurel. I think Hithu is going to work on unmuting anyone with a raised hand. And while she's doing that, I just thought I'd reflect on the fact that very few people scored any of these a 1, which I think is a good sign that most people think there at least be some value or impact from all of those best practices. There are some comments in the chat that some of the best practices are still kind of unclear or foggy. And so I think that's some information that the department will take away and continue to educate about these best practices. And one vehicle for that will be the cross-agency forum.
And I'd also, thank you, Laurel. I'd also like to respond to Brittany, your question about the best practice library. That is actually a best practice that has not been implemented yet. So that's one of those areas that if you all feel like that would be helpful, which I think we got a sense of that in the poll, that is something that could be implemented at a later date, but it has not been implemented yet. We'll try to make that more clear as we go through this training. Some of the best practices have been implemented, and we try to note those that are and provide you with any tools or resources we have. Some of the best practices we'll talk about have not yet been implemented.
I think one other thing to note from the findings is that it looked like more training and education received the highest marks in terms of being impactful. So if folks have comments they want to share about the various topics that would be most helpful, that's definitely information that we want to be providing the department moving forward.
And also just wanted to give a heads up, Laura, that I have unmuted Laura Russell, who raised her hand. So Laura, if you have a question, please feel free to ask.
Sorry, my hand was accidentally raised and we're good.
No
Yeah.
problem. Okay, so I will go next on the list. Next is Katrina. Katrina, if you have a question, you can ask right now. Okay, seems not. So I will go to the next person who has their hand raised, Becky. Becky?
Hithu, I can see the hand
I
raised.
actually,
Oh, there she is. Okay, it looked like she was still muted, so I wasn't sure. Hi, Becky.
hi, I don't have my hand raised, so I don't know how it's showing and I don't have a question. Sorry about that.
That's
I'll
okay.
try to take it down again. Let me see.
Thank you.
How about there? Okay.
Yes. So next person is Rita.
Yeah, I thought I lowered my hand.
Okay, no
Sorry.
problem. I think, and then last person is, oh, two more people, Anne. Anne Russell.
I didn't do anything either.
Okay, it might be, okay, no problem. And then I think last person is Jeffrey, just to make sure if, Jeffrey, you have a question. And if it was just a hand raised, no problem too. Okay, looks like it was an accidental hand raises. We can move forward.
Great. Thank you. Thank you, Hithu. And if there are no other questions or comments, which I don't see any in the chat, I'm going to hand it over to Amy.
Thanks, Laura. If you could advance the next slide. So my name is Amy Downs, and I am a consultant collaborating with JSI on this project. And I'm going to review some of the best practices and interventions that we identified under the second domain, RAE and CMA role clarification, collaboration, and coordination. And similar to Laura's slides, as I go through some of these best practices, we have provided an asterisk next to each best practice where implementation has already begun. So if you go to the next bullet, the first best practice I want to talk about is formalized workflow processes. We recommend that CMAs and RAEs work together to formally document workflows to improve collaboration and coordination. This would include how tasks are divided and the sequence in which they are completed under different scenarios, like hospital discharges. We know that a number of RAE and CMA partnerships have already been working on these, and they can get fairly complicated. This is a good topic to cover at the cross-agency forum where RAEs and CMAs are getting together to share how they are already tackling some of these. For example, at the cross-agency forum, RAEs and CMAs can share how they've taken on formalizing workflows and what they have learned from this process. The next best practice is coordinated and aligned member outreach. One of JSI's principal research findings is that coordination of members and outreach needs to be improved because it also leads to confusion among HCBS members and HCBS waivers. So some of our recommendations include CMAs initially connecting with the new member, explaining the role of the CMA and the RAE, how those roles are different, and then RAEs following up later. But what's most important is that whatever process CMA and RAE partnerships agree to, it is clear and transparent to all CMA and RAE staff. This outreach can be formalized in a workflow process that RAEs and CMAs work together on. And the third recommendation is RAE and CMA liaisons. So each RAE and CMA should have a designated staff member who serves as the point of contact or liaison between the two agencies. The liaison would have oversight of many of the best practices that we're talking about today that we've summarized in this project. Liaisons would engage in communication and collaboration with their counterpart agency to prevent cases from escalating into crises. And as we mentioned in the last training, the new CMA contract implemented earlier this year does include a requirement that a liaison is designated. And the RAE contract requires RAEs to designate a staff person to serve as the point of contact for various settings within the healthcare system. Next item is formal coordination agreements. We recommend that RAEs and CMAs have formal coordination agreements such as memoranda of understanding that specify how the organizations will work together. Formalized coordination agreements could also include workflow processes that I previously mentioned. And similar to formalized workflow processes, the purpose of coordination agreements is to increase transparency, to formalize who is doing what at which agency, and to prevent RAE and CMA staff members from wondering who is the lead on which activities. This domain's last recommendation is meeting frequency and standardization. And I've got more detail on that on the next slide. So we learned from stakeholders in our research that to collaborate and communicate more effectively, RAEs and CMAs need to have standardized meetings that occur according to a regular cadence. So the first we've mentioned here is caseload review meetings. We recommend that RAEs and CMAs have weekly caseload review meetings where they check in regarding their shared members and review important status updates. The second recommendation is locally led complex and creative solutions meetings. RAEs and CMAs should establish a process for these meetings. They would be for very complex cases that need an immediate solution, and collaboration cannot wait for caseload review. So the objective here is to have local collaboration on these cases and avoid escalating them to the department. Beginning last spring, these are now required in the new CMA contract. To support RAEs and CMAs in setting up standardized meetings, JSI has developed a meeting charter template. It's a document that meeting participants would fill out that is a collective agreement about the purpose of the meeting, the time, the date, the guidelines, format, and basically anything else that participants think is relevant to add. The RAE and CMA liaisons have access to the template, and we encourage you to use it. In addition, JSI has also developed a policy and procedure template where CMAs and RAEs can define policies and procedures that will guide their standardized meetings. Again, the RAE and CMA liaisons have access to this template. So now we want to take, if you go to the next slide, we want to hear from you. We've got another poll where we want to know from you the impact that you think these best practices will have on improving role clarification, collaboration, and coordination. So similar to the last poll, we want you to rate things on a scale of 1 to 5. So 5 means most impactful. You think that that best practice will be very impactful, and 1 means least impactful. You don't think it'll really be impactful at all. So we're going to pause and give you some time to fill that out. So we're going to give you some time. So remembering that 5 is most impactful, 1 is least impactful. And Laura, I'm going to ask you, I'm not able to see the results of this, so I'm going to ask you if you can review that for folks.
Yep, I'd be happy to do that. We still have responses coming in, so give it a few more minutes.
So 5 is impactful, very impactful. 1 is not impactful at all.
Okay, looks like they've slowed down. So I'm gonna go ahead. Oh, I've got a few more people, actually. Go to another minute. Okay, I'll share my results.
Oh, okay. Well, I can actually see them now. Thank you. Okay, so for the first one, formalized workflow processes, we have about half the people ranking this as most impactful in a 5, and just a couple of folks thinking that it's not going to be impactful at all. So it feels like formalizing workflow processes is in something that is really, resonating with a lot of people. If we go down to the next one, we've got some similar results: coordinated and aligned member outreach. Between the folks that think it's a 4 and a 5, it's about 71%. So about 50% gave it a 5, and 21% gave it a 4. So again, that's another one that I think looks like it's going to gain a lot of traction. RAE and CMA liaisons. Similar results. We've got about half the people that think it's going to be very impactful. Just a handful that have some concerns about the impact that will have. So that's something to look forward to being implemented. Formal coordination agreements, about 37% think it's most impactful. 21% gave it a 4, and just a handful have given it lower scores. So something else that I think we should look for. And then meeting frequency and standardization, that's similar to formal coordination agreements. We've got 37% giving it a 5, 20% giving it a 4, and about a third more on the neutral side. 29% giving it a 3, and just a handful giving it a 1 or a 2. So I think, when we look at this, those top 3, I think, are resonating with people the most. That's formalized workflow processes, coordinated and aligned member outreach, and RAE and CMA liaisons looks like where we've got probably the most traction. And so similar to the discussion that Laura just had with all of you, we want to hear from you if there's other best practices within this domain of collaboration and role clarification that you'd like to see added to this, that you think could be impactful, or if there's other reflections that you have that you'd like to share with the group. So if you raise your hand, we'll take you off mute, and we'll just take it from there.
Yeah, so we have one person who has raised their hand, Ira. I will unmute her right now. Ira, do you have comments? Ira? Okay, looks like not. There is a question in the chat, Amy.
Yes. Let me scroll up. Is this from Nicole? Oh, it looks like Kithy, do you want to read out the question that?
Yes, the question is, this sounds great in theory, but how do we hold each organization accountable? And this is from Nicole.
Yeah, and Nicole, it looks like Lauren from the department did answer that. There have been some requirements added to the RAE and CMA contracts. And there'll be, when we implement the Accountable Care Collaborative 3.0 in July 1 of next year, when that phase 3 is implemented, there'll be more requirements. There's also going to be, as Laura was mentioning, the cross-agency forum where RAEs and CMA's leadership will be in attendance at that. And that's really a place to, we're going to be holding for some of that collaborative work and talk through these systems issues moving forward. So that's a place to do some of that troubleshooting. We have a question from Jessica. Are you reaching out to CMA agencies that are not present to complete the training? Yes, we are disseminating this widely. This training is being recorded. There are links that are going to be posted. We also encourage you to share this training with some of your counterparts or your colleagues that you think will benefit from this. So we would like to see as many people representing the CMAs and RAEs as possible attend this training.
Amy, I just wanted to jump in and remind everyone if they could put their questions in the chat and we will answer them and open up microphones for people at the end. So that we can move through some of our polls. But if people have comments regarding the different polls we're doing, you can comment during the training.
I wanted to also just go back to one of the questions I asked a few minutes ago. When you look at some of these best practices for collaboration, coordination, for role clarification, are there other items that you think would be impactful or helpful? And again, if you raise your hand, Hithu can take you off.
Yes, taking Kristen off mute. Kristen, you can talk now.
Okay, thank you.
Yes.
I was just wondering, I am all for the CMA and RAE liaisons. I'm just concerned about the communication or disbursement of that information among the different agencies. I'm concerned that might be a bottleneck. So that's all I have.
Can you say a little bit more?
So if there's one liaison from a CMA and one liaison from a RAE, and those two are exchanging information, how does it disseminate through the entire agency?
Yeah, so I mean, I have a couple of thoughts about that. It is the liaison's role within the CMA or the RAE to be doing that. We've provided, and we're going to talk a little bit more about like an online shared workspace where some of that information can be disseminated. But I think, you know, to a large extent, we're expecting agencies to know their own communication processes and what works best. There's also this cross-agency forum where once a month, the CMAs and RAEs are coming together to be talking about these shared issues. There's notes that are coming from that forum that all the CMA and RAE leadership are going to have and the liaisons have access to. So I think there's a lot of ways that CMAs and RAEs can structure their internal communication to make sure that they're staying apprised within the organization about the implementation of the different best practices.
I'm sorry, I guess I'm just more concerned that we know that there's communication issues within some of these agencies. So if we're putting liaisons in place, how are we going to know that this communication is going to work because of known issues within the agency currently. So I'm just using that as a, just a heads up, you guys, there are already internal issues that need to be fixed before we add additional things.
Sure. And it looks like lots of your colleagues are agreeing with you based on the reactions. Yeah, I mean, part of the idea was to try to streamline this to make it one person's responsibility and have that person accountable for that. But I certainly hear your concerns.
Thank you.
Okay, I think with that, we'll move on to the next domain. The next slide, please. Data sharing and technology. Okay, so the third domain we're going to talk about today is data sharing and technology. This includes in the first bullet, data sharing itself, having data sharing agreements. And then in the second bullet is data exchange. So before the data exchange happens, there need to be agreements in place. And then the third item is having shared system access or a shared online workspace. So with data sharing, if you go to the next slide, please. Basically, as you all know, there is not one data system that includes all of the information for shared members. So we recommend that RAEs and CMAs enter into agreements to share data between themselves regarding those shared members. And these agreements are an important precursor to actually exchanging data, which we all know is critical for patient-centered care. These agreements would allow RAEs and CMAs to share information about shared members in order to have greater transparency regarding member status and services, and ultimately improve the member experience. So as you all know, the CMA 2024 contract includes the requirement that data sharing agreements between CMAs and their RAE counterpart were put in place by September 15th of 2024. And we know that many RAE and CMA partnerships already had some sort of agreement in place. However, these may be new for other partnerships. Now, the department and JSI cannot determine what type of data sharing arrangement or tools RAEs and CMAs should use. Ultimately, it's up to the RAE and CMA to make that decision. However, as part of JSI's implementation support, we have provided some data sharing considerations to think through as you move forward with these agreements. And the information that JSI has provided explains the differences between contracts, business associate agreements, memoranda of understanding, and data sharing agreements. And again, the RAE and CMA liaisons and attendees at the cross-agency forum have access to this document, which summarizes these considerations. If you go to the next slide, there's some information about online shared workspaces. We recommend that CMA and RAE partnerships establish their own online shared workspace that leaders, liaisons, and other staff members at each of the organizations can access. The purpose of the online shared workspace is to streamline implementation of best practices, have greater communication and transparency, and keep appropriate staff members at both agencies apprised of the collaborative work that is being conducted. So this slide lists some examples of items that could be shared via online shared workspaces. So as you work on coordination agreements or workflow processes, have these on that online shared workspace so that the relevant staff members have access to it. Same with like meeting notes and next steps and who is after, the coordination or case review meetings, who is responsible for what. Just making sure that that information is available for both CMAs and RAEs. So the next domain is contracts and oversight. And specifically, what we recommend is first that RAE and CMA contract language with the department is aligned and transparent. So for example, when there are shared responsibilities, it needs to be as clear as possible in both RAE and CMA contracts. We also recommend in the next bullet that contract requirements are as specific and measurable as possible, so RAEs and CMAs understand the expectations of them by the department and their counterpart agencies. However, we also know that the specifics of every member's situation cannot be predicted and outlined in contracts. Therefore, RAEs and CMAs also need to rely on the best practices we've been discussing today and the tools that are being provided in order to collaborate and coordinate members' specific needs. In the next bullet, we recommend multi-tool oversight methods. And what we mean here is that as contracts become more specific and include more measures, we recommend that instead of adding new contract deliverables, which can be administratively burdensome for the department, for RAEs and CMAs, that to the extent possible, any new reporting requirements are rolled into existing reports that are already being submitted. Or instead of adding a new site visit to evaluate adherence to program goals, existing site visits should be used. So now I'm going to hand it over to Laurel, who will be talking about member experience and satisfaction.
Thank you, Amy. Good morning, everyone. My name is Laurel Karabatsos. I'm a consultant working on this project with JSI. As Laura and Amy just discussed, JSI identified best practices across 5 different domains. If those best practices are implemented successfully, all of them will contribute towards improving member and family experience and satisfaction within the Medicaid program. As you may recall seeing earlier in the training, improving member and family experience was a central theme and overall objective and goal of this project. As a result, JSI has identified additional best practices targeted specifically towards improving the member and family experience. These best practices may take more resources to implement and therefore may be longer-term innovations. They will be listed on this slide, beginning with improvements in communication regarding waiver eligibility status. We heard a fair amount of feedback regarding the confusion related to and the length of time required for the waiver eligibility process. The department could consider implementing additional ways to support members and their families as they are awaiting an HCBS waiver eligibility determination. Possible ways to support families range from improving communications, expediting the process, all the way to looking at complex system changes to allow for real-time information. The next best practice in this area is enhanced member education and communication. As we all know, Medicaid is a complex program. Members and their families often don't know what services are available or where to go for help. Improving communication and education in these areas can help increase satisfaction. Next, we've identified a best practice around exploring integrated care models for members with complex needs. As we discussed in the first training, RAEs and CMAs identified that they experience the most challenges when coordinating care for individuals with complex needs. Some states are exploring innovative integrated care models to support individuals with the most complex needs. Integrated care embraces a whole person care approach by fully integrating care from multiple sectors. The next best practice is measuring member experience of care. The department currently assesses member experience in a number of ways, including the National Core Indicators on the HCBS side and the CAPS survey, or the Client Assessment of Healthcare Providers and System survey for the RAEs. With the implementation of case management redesign, case management agencies are also required to conduct their own survey, but they may use or create their own processes and tools for doing that. As a result, the mechanism for evaluating member experience will vary across CMAs. The department could explore ways to align surveying, public reporting, and the use of dashboards, and even consider requiring the use of a single survey across agencies and programs. The final best practice identified in this area is evaluating caregiver stress. In addition to measuring member satisfaction, some state programs are beginning to evaluate caregiver stress as a measure of program effectiveness. Family members are often informal or formal caregivers for their loved ones, and therefore reducing caregiver stress can have a direct impact on care and satisfaction. Next, we would like to do another quick poll related to the best practices targeted towards improving member experience and satisfaction. As we've done in the other polls, please rate on a scale of 1 to 5 how impactful each of these best practices will be in improving member experience and satisfaction. As a reminder, a score of 5 means the item will be highly impactful, and 1 is the least impactful. We'll give a few minutes here for you to enter your scores. And then Laura, I believe you'll just share those once they come in.
Yep, and there are lots of responses coming in now.
Great,
Let's give
thank
it a
you.
little more time. Sorry, still have lots of responses coming in.
Okay, great. Are they starting to slow down, Laura?
Yep, they're starting to slow down. So if you can get your response in there, I'm going to close it in a couple of seconds here. Okay, looks like. All right, I'll share the results.
Great, thank you. So again, looking at the results here, if we just look at all of them across the board, you'll see that the first one around waiver eligibility status and setting up more communications and supports received the most 5s. And it looks like 57% of people felt this would be very impactful. And that certainly aligns with the feedback we got during key informant interviews at the beginning of this project, that is an area of difficulty. The next one, and also the rated next high with 54% of 5s, is increasing member education and communication. And that makes a lot of sense. A big piece of this project is around education and communication. And so continuing that onto members makes a lot of sense. The third area were the integrated care models, and it looks like about 44% of people thought that would be impactful. And I wonder on this one, JSI did some research throughout the project to look into integrated care models. And perhaps this is an area for some ongoing discussion and training, as it may be a newer concept to a number of people. And so this might be a topic that the department can put on a cross-agency forum or other forum. The next was member experience of care, and that received the fewest number or percent of 5 scores with 31%. And I'm curious, there are already several ways that the department measures member experience, and that might be part of why it received a little bit lower score. But once I finish walking through these, perhaps people want to share some comments on why maybe that's scored a little bit lower. And then finally, evaluation of caregiver stress, which we found to be a little bit more of a newer, innovative practice that states are doing. That received 41% of 5 scores. So again, pretty close to some of the others. But Hithu, I don't know if people have their hands raised. Would anyone like to make some comments on why they scored like they did? Again, as we've asked for the other polls, are there items that would really impact member and family member satisfaction or experience of care that we didn't identify that you think should be added? Does anyone have any comments right now? And again, hold your general questions for the end. We'll be getting to them very soon. But if you have any comments about this poll, we'd love to hear from you.
Yeah, no raised hands as of now, Laurel.
Okay, great. Well, why don't we continue? I know there are a number of questions, so we'll move on with the training so that we can get to some of your questions. As you've all heard today, the department and RAEs and case management agencies have already been making great strides and begun to implement process improvements that will maximize communication, collaboration, and cross-agency coordination. Through this training, we have summarized 22 best practices that can be employed by the RAEs and CMAs. There is a detailed best practice report that JSI drafted that provides more detail and can be accessed by reaching out to your organization's liaison or point of contact for this work. JSI will be wrapping up their work on this project the end of this month, but the department's already making plans on how to keep the transformation going. Please watch for more communication from the department regarding this work. And before closing, as I mentioned, we'd like to take a few minutes to answer your questions. It looks like we're already on the question slide. I'd like to invite my colleagues, Amy and Laura, to help me sort through some of the inquiries in the chat so that we can answer your questions. Laura, would you mind sharing the first question with us?
Yeah, sure. So a couple questions came into the chat about the first question was about where people can find the templates that we've referenced to review. And then also just general questions about the shared site and not knowing who the liaison person is. So looking for clarification on where they can access the shared site. And Laurel, I believe you answered this in the chat, but I thought it was an important enough question to maybe re-ask it at the end and provide some clarification.
Yeah, thank you, Laura. I'm going to ask Brooke or Lauren to maybe talk about the shared site in just a minute, but also wanted to respond to the portion of the question that individuals don't know who their liaison or point of contact is. And so I think that's something, first reach out within your own organization. But if you're for the point of contact within your organization, and you can always reach out to a contact you do have at your partner organization. But this is a topic that we've put on a list of potential agenda items for a cross-agency forum. It may be a task that that forum would like to put together a directory of liaisons and points of contact so that everyone can go to one document to find who their point of contact is. So we'll certainly make that recommendation. And would someone from the department like to share a little bit more about that shared space?
Sure, I'll jump in. This is Brooke from the department on the ACC side specifically. I put a link in the chat to this, what we're calling the RAE CMA collaboration SharePoint site. If you don't have access and you are a RAE, there is a person here on the ACC side, Erin Herman, who can give you access, and her email is in the chat. If you're on the CMA side, Jennifer Larson here at the department can give you access to the RAE CMA collaboration site. You know, at this time, it's still kind of evolving. We've got just sort of 4 sections. One section that's specifically for the cross-agency forum meeting materials. So we've got notes in there, presentations. We've got some of those templates that folks had talked about earlier. We'll also put links to the trainings, and we also have some of the foundational project work that JSI did for us as part of this ARPA-funded project. So this will evolve. I think at least 1 or 2 per people at every organization, all the RAEs and all the CMAs currently have access to this site, and it will be evolving and growing as the collaboration continues, you know, to evolve between the RAEs and the CMAs. Do I need to say anything else about this?
I think that's good for right now, Brooke.
Okay.
And do want to mention that JSI is just now wrapping up this project, you know, with these 2 trainings. So there will be more information coming out and more communication on where you can find things and who are the liaisons. So we really appreciate all these questions and interest, and we'll continue to make sure that the department is sharing information on this.
Great. So another question that's come up in the chat and did get addressed, but I just want to make sure everybody hears it because it's probably on a lot of folks' mind. Would the liaison's only role in the CMA or RAE be as the liaison, or is that person going to be carrying a caseload or being a manager? And I think it depends on, that's a decision to be made by the organization. If it's a smaller organization without a lot of staff, the liaison is likely to wear an additional hat, but maybe larger organizations have the capacity for someone to do that on a more full-time basis. But we're leaving it up to the RAEs and CMAs to determine that. And if anyone from the department also wants to weigh in on that question as well, please feel free.
Thank you, Amy. I'll go on to one of the next questions. It's a little bit longer question, so I'll read it. Someone wrote, I appreciate the autonomy given to the agencies to structure communication processes and other workflow processes. However, if we are going to be held accountable, it would be helpful to have a structure and standardized process that we can build off of. I appreciate this question. And think it really fits well with this project, which is about creating some standardization and common ways of doing things. I want to remind everyone, you know, that case management redesign, the department is just getting all those contracts underway. It hasn't been that many months. They added several requirements for case management agencies to their contracts. The ACC Phase 3 contract will be starting next July, and there will be new requirements there. And so I think on some of these things, the department is trying to build up requirements and expectations and introduce them a little bit slowly, like starting with a liaison and then maybe working towards more standardization in terms of duties and meetings and that type of thing. But I do think the idea of increasing the standardization across all agencies makes sense and resonates with the department. And I think the ongoing cross-agency forums are a great venue for the CMA and RAE liaisons and point of contacts to talk about some of these best practices, and which ones need the most standardization, and to prioritize some of that work and begin working on it with all of you.
Laurel, excuse me, Megan has her hand raised, so I think Megan may have a question. Hithu, if you can unmute her.
Yes. Just unmuted you, Megan.
Thank you. Hi. Yes. So it's not really a question. I've just been looking through the chat, and I think some of our partners, so some RAEs and CMAs do have more collaboration processes in place. And I don't know if it'd be possible. It seems like there's a lot of different levels of participation in this meeting. If we just really encourage like staff to go to their leadership to see what processes are already in place with their RAEs or CMAs. I think that would be helpful. I think some of us with the liaison role, as some of you said, it's kind of an interpretation between RAE and CMA, and it's not black and white, and it's taken a long time to kind of define what that does or doesn't look like. And so I don't know if with the training we just when it's sent out, if we can encourage people to talk to their leadership at their agency first to see if there is something in place already.
Megan, thank you for those comments, and they're really important comments. That we have 600 plus people that registered for this training. And while JSI and the department have been providing updates to case management agency leadership and liaisons, and the same with RAEs, not all staff are in attendance. So I do think it'll be important as the project gets wrapped up for the department to communicate with agencies around how they can share this information internal to their own organization. So thank you for sharing that.
Yeah, thank you, Megan. I think this next question, Amy, might be a question for you to answer as it relates to data sharing. The question is, what is meant by business associate agreements? Is that referring to outside agencies such as NWCCI or DHS? Or is that referring to each case manager CM within the agencies? Or is it meaning something entirely different?
So we have a whole document on data considerations that talks about some of the differences of these various tools. But at a high level, a business associate agreement would be a written agreement that specifies each party's responsibility. So the CMA's responsibility, the RAE's responsibility when it comes to accessing and managing personal health information. So it's a legally binding document for HIPAA covered entities, and there are business associates to ensure the complete protection of PHI. So it's going to be a legally binding document. It's going to be signed by both parties. And it's really intended for protecting protected health information is required by HIPAA. So it would be between the CMA and the RAE. Now, as I mentioned in my comments, the department JSI can't weigh in on which tool you should use, if it should be a business associate agreement, or how you want to, if you want to look at memorandum of understanding or different combinations. But the RAE and CMA leadership and the liaisons have access to this document of considerations, and we've been talking about it also at the cross-agency forum.
Thanks, Amy. I can take this next question that came in through the chat. And the question is, how are these practices determined to be best practices if they haven't been implemented yet? Is that based on implementation in other states? And yes, that partly is based on implementation in other states, but more so than that, as I mentioned in the beginning of the training, this initiative was really very much a stakeholder informed initiative. So at the beginning of the project, the JSI team talked to a number of you all and other people within the state to identify kind of what's working well, what's not working well. We also did a literature review and talked to people in other states to identify some areas of practice that were being implemented that were successful in improving collaboration and coordination. So these best practices were developed by the JSI team based on the research we conducted at the beginning of the project. And Laurel or Amy, do you have anything to add to that?
No, I think you responded to that question well. Looking at the chat, I think we've covered most of the direct questions. There are a couple comments that maybe I will just highlight while we wait to see if anyone has any final questions. There was a comment about streamlining the number of surveys that members are asked to complete. And so again, I think that's an important consideration or recommendation that maybe can be discussed a little bit further in the cross-agency forum. Sometimes it is challenging to streamline surveys when you have so many different programs and angles that you're looking at information, but we'll certainly bring this recommendation back to the department. There were also a few comments that it was challenging for some of the participants in this training to rate some of the best practices because they had limited information, and appreciate your comments and sharing that. That makes a lot of sense. As I shared just a few moments ago, we have been updating leadership and liaisons throughout the project, but now that we're wrapping up things, this will be something for the department to be mindful of. How do we get this information out to all employees within the organizations? And some of these best practices that aren't well understood are probably excellent topics for cross-agency forums or even meetings between RAEs and CMAs to discuss on an individual basis. So appreciate your comments there. I don't see, Laura, double check me that we've received any additional questions. So I'll maybe just make one last call for questions and then quickly wrap things up. You'll get a few minutes back in your day today. Looks like no additional questions. So in closing, on behalf of the department and the JSI team, we'd like to thank you for attending this training and providing your input. As we've mentioned earlier, a recording of this training will be sent to all participants and made available for ongoing use. If you are aware of someone who was not able to attend the training who you think would benefit from the training, please do not hesitate to share it with them. Also, a reminder that we did record the first training as well, and that will be made available. And it may make some sense for staff that haven't been actively involved in the project to date to start with that first training where they hear a little bit more about the project and roles and responsibilities of the RAEs, and then watch this second training where we dig into some of the best practices. Again, want to thank you for your participation and encourage you to please continue to engage in this work through your individual RAE and CMA partnerships and meetings and through the cross-agency forum as appropriate. Thank you, everyone.
Thank you.